Right now at 5:30, we're asking state leaders what major cuts to the Department of Health and Human Services and funding could mean for families in our area. 10,000 jobs are being eliminated nationwide and at least 80 here in North Carolina. Our state will also lose $100 million in federal funding. Thanks so much for joining us. I'm Lena Tillett.
And I'm Dan Haggerty. Some here in North Carolina are worried about what else might be on the chopping block. WRAL's Capitol Bureau Chief Laura Leslie is live in Raleigh. Laura, you spoke with the state health director in about the last 3 hours.
I did. Interim State Health Director Kelly Kimball said they had no warning, no advance warning that these cuts were coming down the lane, leaving them just scrambling to try to keep up. They're still trying to figure out exactly which programs and which jobs are going to be lost. And they're also worried that this may only be the first round. Immunizations, infectious disease control, mental health, and addiction. These are just some of the services the state is losing funding for due to federal grant cuts totaling at least $100 million.
That this is a significant amount of funding and we're going to feel the impacts no matter what. And I think this is going to be real for North Carolinians.
Interim State Health Director Kelly Kimball says DHHS will lose at least 80 jobs. Other job losses may come at the local level, where the funding paid for services at local governments, hospitals, and universities.
We are continuing to work to understand that impact, but also where we can mitigate, knowing that this is a large amount of funding, that we can't fill that gap.
Senator Natalie Murdoch is concerned more cuts could be ahead, and the state may not have the money or the political will to cover them.
That is the elephant in the room. The uncertainty of federal dollars impacts every single department we have in government.
Medicaid is the biggest concern for lawmakers. President Donald Trump has said he won't touch the program, but congressional Republicans are pushing for big cuts.
As a state that finally expanded Medicaid, it's scary.
Under the state's Medicaid expansion law, any reduction in federal funding will trigger a shutdown, kicking 600,000 people off the rolls. I asked Senate Leader Phil Berger about that.
Is that something that y'all are prepared to allow to happen?
First of all, I don't think we're going to get to that point. The folks in Washington have a long history of talking about a lot of things and a very short list of things they actually do.
Berger said they are keeping a close eye on it and they will take some type of action if it becomes a problem. He's just not convinced yet that that's going to be the case. Laura Leslie, WRAL News, live in Raleigh.